So the topic I have to discuss with you is about digestive disorders in those young children and so disorders of gut-brain interaction. So functional gastrointestinal disorder is what it was called before. In infants and toddlers, they are in general said to be common worldwide, and they cover a variety of disorders associated with chronic symptoms attributed to the gastrointestinal tract. And now, up to now, we lose the Rome 4 criteria, but soon, in 1 year time, there will be new criteria to be used. The Rome 5 are coming up. But already mentioned in the Rome 4 criteria is disorders of gut-brain interaction. So although these disorders of functional gastrointestinal disorder, they are functional, we call them now different, emphasizing that the term functional should not be misconstrued to imply a non-organic condition. So it's more about communication between the gut and the brain, and that's probably mainly through the gastrointestinal microbiome, but that's the topic for tomorrow. When I was asked to discuss this, and since this seminar is more about diversification and toddlers, I thought I will not talk to you about colic, because that has long time disappeared before those infants get diversification, and colic is frequent, 20 to 30% of all the infants. But I'm sure you heard a lot of presentations about colic. The same is true for infant regurgitation, also occurring in 20 to 25% of all the infants, but disappearing more or less about the age of 1 year, when the infants start to live upside and walk around, then the regurgitation disappears most of the time. In fact, in the age group we are focusing on in these 3 days, which are the disorders of gut-brain interaction, which are mentioned in this age group, it's not so much. It's cyclic vomiting syndrome, functional diarrhea, and as you can see, functional constipation. So what do we know about the prevalence of these gut-brain interactions in toddlers? In fact, not so much, as you can see on this slide, which is coming from Latin America, which is about the only study which recently had a look at the prevalence of those disorders in this age group. And the data are probably a little bit biased, because it's data from 10 pediatric gastrointestinal outpatient clinics, so it's already a selected population of children with symptoms. So it's probably overestimating a lot the prevalence in the real world in the unselected infants. This slide also shows very nicely how colic, dyschezia, regurgitation disappeared in this age group. But so functional constipation in about 30% of the infants, cyclic vomiting syndrome 4%, functional diarrhea 1%. From the same paper, if we look at cyclic vomiting syndrome, the age is a wide range. Prevalence, according to this study, 34%. And then prevention of triggers, prophylactic medication, abortive medication, supportive measures for the treatment. The pathophysiology is, in fact, not really known, but usually it resolves as the child gets older, may continue or change to abdominal migraine or migraine headache. In other words, we don't know too much about the cyclic vomiting syndrome. Functional diarrhea It's due to estimated dietary and motility abnormalities, increased mucosal secretion. Management which is recommended is education, dietary changes, and it usually resolves by the age of 5 years, and then you have at the end functional constipation, results from painful defecation associated with withholding in most of those children. And so management, education, behavioral interventions, laxatives, and successful long-term treatment in up to 80% after the first year and increases over time. But so there is, since we call it disorders of gut-brain interaction, and for these conditions, communication between what's happening in the gastrointestinal tract through the nervous system to the brain. And so even at this age, the proposed mechanism for gut dysfunction is stress and disease, which causes dysbiosis, or which is related to dysbiosis. And so focus is, for all these conditions, on that gastrointestinal microbiome. A few words more about the cyclic vomiting syndrome. According to those ROM4 criteria, these are the criteria, so 2 or more periods of unremitting paroxysmal vomiting with or without retching, lasting hours to days within a 6-month period. Episodes are stereotypical in each patient, and they are separated by weeks to months with return to baseline health episodes of vomiting. But if you do Google and you do cyclic vomiting syndrome or cyclic vomiting in toddler, you just find 13 references. So it's hardly known. So we say it occurs from infancy to midlife and is most common between 2 and 7 years. In a study from Ireland, reported 41 cases. Median age of symptoms was 4 years, with 46% of the affected children having an onset of symptoms at the age of 3 years or younger. And so you see 2 other papers, it's 181 cases, 71 cases. So the question is it really that infrequent, or do we not recognize it? Because at a younger age and at an older age, disorders of gut-brain interactions are much more frequent than in this age group. The same can be said for functional diarrhea, which was previously called toddler's diarrhea, and or chronic non-specific diarrhea. Again, you get specific definitions in the ROM4 criteria, but again, little is known about it. So according to that study from Latin America, prevalence of functional diarrhea less than 1%, but according to ROM3 criteria, it occurs in 2.4% of the infants under 1 year and 6.4% of the toddlers present with functional diarrhea. So again, it's a condition for which you find a lot of contradictory information. Mechanism proposed is lack of postprandial motility in the small intestine, but it's not proven at all, so it's just an estimation. The evaluation of children with those chronic diarrhea includes overfeeding, excessive fruit juice consumption, excessive carbohydrate, mainly fructose ingestion with a low fat intake, excessive sorbitol intake. But in fact, in the true functional diarrhea, those children do have diarrhea with a well-balanced diet, and we just have no clue why they develop this diarrhea. So 2 conditions which are very poorly understood in this age group, And then we move to functional constipation, which is again well defined in the Rome criteria. I will not go further in it. But frequency of constipation in this age group, it's somewhere between a couple of percent and over 30%, again, depending on literature, which definition is used. But so you see that according to studies, it's 10%, and then the Latin America study reported 33%, a cohort study from Brazil, 27% at the age of 2 months. So absolutely sure that constipation in toddlers is much more frequent than the two previous discussed conditions, and at least for constipation we understand better the reasons. What's the management for constipation in this age group? Well, not different than from the other age groups. It's drink more water, eat more fibers, go regularly to the toilet, physical activity, and then the standard medication to be given is, according to Rome 4 from 10 years ago, it's polyethylene glycol, which is the first line option. And just last week was this paper published confirming, repeating that polyethylene glycol also in this age group is probably more effective than placebo, and key comparator therapies and should be considered the standard of first-line care after, of course, the dietary and physical activity measurements, as I just mentioned to you. A few words about lactose intolerance, because at least in our country, a lot of colleagues think that those children, young babies, toddlers, do cry a lot because of lactose intolerance. There are 4 main clinical types: the congenital lactase deficiency, which you will probably never see. At least there are 12 cases described in literature, most of them from Finland. There is the developmental lactase deficiency, there is the secondary lactase deficiency, and there is the lactase non-persistent hypolactasia primary late onset. So there is lactose malabsorption. That means that the lactose is not completely absorbed but does not cause any symptom. And with lactose intolerance, the lactose is not absorbed but causes gastrointestinal symptoms such as nausea, cramps, abdominal pain, distension. You know them much better than I. But is lactose intolerance really an issue in children under 3 years of age? Probably not. If you look at these data from Japan, in children younger than 2 years, the prevalence is 0%. Over 6 years, it's 85%. And depending on the age, you see how these differences are reported. Data from Indonesia, 3 years, 4 years, 5 years, shows you very nicely that the number of children with a positive breath test at 3 years is very low and does not say anything about symptoms. And then gradually, as those children get older, the percentage of children with positive breath tests increases. And over the evolution of years, this tolerance to lactose may have increased. At least that's one of the hypotheses they have in Indonesia. But again, this slide shows nicely that the prevalence of lactose intolerance is depending on the age and is absolutely not frequent under the age of 3 years. Finally, moving also a little bit to the older children in this age group, functional abdominal pain in the children of 3, 4, 5 years old. Earlier this year, this consensus paper with colleagues from Latin America, from Asia, from Europe was published, and it's more expert opinion than based because there is absolutely a lack of literature, a lack of research for functional abdominal pain in this age group. Overall, we say if there is no arguments for one of these conditions, there is no reason to put these children on restrictive diet. It's, of course, it all depends on your history, your physical examination, eventually results of complementary investigations. But if everything is normal, there is no evidence at all for recommending these elimination diets because they are then often prolonged without any benefit and may lead to dietary imbalance in those children. The only thing which comes out from literature is that you could give some probiotic strains for functional abdominal pain, as here with the World Gastroenterology Organization. And this study, which was published a couple of years ago in the European Journal of Pediatrics, shows nicely again that there are quite some data that the administration of probiotics for functional abdominal pain, not constipation, in this age group might be beneficial. And also with the SGAN group, we recommended to try this probiotic in this age group, although certainty of evidence is moderate and the grade of recommendation is weak. But at this moment, there is, I think, nothing better to offer than this. So the take-home message is that disorders of gut-brain interaction in toddlers, we lack reliable data. It has very poorly been studied, and for me, it's still unclear if they are, besides constipation, really not frequent, or if we do simply not recognize them. Constipation, cyclic vomiting syndrome, and functional diarrhea are the three major disorders of gut-brain interaction. For some children at the older age, lactose intolerance is sometimes a possible cause, but really not frequent because up to 3 years, most of the children do tolerate lactose. So there is limited information, and mainly because those children are also mostly handled by primary healthcare physicians, and that's why it's so difficult to collect reliable information in this age group on disorders of gut-brain interaction. So I would like to thank you for your attention.